Hey, my name is Ashley, and I'll be talking to you about exercise prescription for people with arthritis. So, arthritis is inflammation of one or more joints. It causes pain and stiffness that worsens with age. Arthritis and rheumatic diseases are leading causes of pain and disability. There are over 100 rheumatic diseases. The two most common is osteoarthritis and rheumatoid arthritis. With osteoarthritis, it is a degenerative joint disease that can occur in one or more joints. Rheumatoid arthritis is a chronic systemic inflammatory disease. Other other common rheumatic diseases include fibromyalgia, gout, and bursitis. This can be treated with medication, but optimal treatment um, includes patient education and management, physical therapy, and occupational therapy. And exercise can reduce the pain. It maintains muscle strength around affected joints, reduces joint stiffness, and prevents functional decline, and improves mental health and quality of life. How doctors diagnose this disease? They'll consider the symptoms. They'll perform a physical exam to check for swollen joints. They'll do a blood test and do an X-ray to confirm it, and the blood test and X-ray will also help to distinguish what kind of arthritis it is. For exercise testing, most individuals with arthritis tolerate the symptom-limited exercise test, just the same as the recommendations for those in the apparently healthy population, so they can do the same test. They also tolerate the treadmill okay, but it may reduce the pain if they do the ergometer, the cycle ergometer for the legs, or a combination of the legs and the arms. And whenever you choose a mode of the exercise test, you want to choose the one that causes the least amount of pain for them. You want to give them time to warm up at a light, intense exercise before doing the test, and you just want to monitor their pain during the test. And if it becomes too severe, you want to terminate the test. Muscle strength and endurance can be measured using regular protocols. However, pain may limit maximum muscle contraction in affected joints. All right, going over their exercise prescription for aerobic exercise, they'll want to do this 3 to 5 days per week at a 40 to 60% VO2 reserve or heart rate reserve. But for those who are very deconditioned, you want them to start out at a 30 to 40% VO2 reserve or heart rate reserve. Their goal is to try to reach at least 150 minutes per week. But the long continuous bouts of exercise may be difficult for someone with arthritis. So starting with short durations of about 10 minutes, maybe a little more or a little less. You just want to start with short bouts and gradually increase their duration over time. The type of activities you want them to do are low impact activities. So walking, cycling, or swimming would be great for them. High impact activities are not recommended. For resistance training, you want them to do that 2 to 3 days per week. You want them to do 10 to 15 reps at a 40 to 60% 1RM and just gradually increase their intensity over time. With flexibility, you just want them to do it daily and go through all the range of motions. Special considerations for this disease: you want to avoid strenuous exercise during flare-ups and periods of inflammation, but it's okay to go through the range of motion on those days. Just gently go through it. You want to allow adequate time for a warm-up and a cool-down before and after each session. Those that are in significant pain, like I said before, you might want to start them off at a lower duration. You don't automatically go straight for the 150 minutes per week. Maybe start them off at about 50 and then gradually bring them up. You want to let the patient know that they may feel a small amount of discomfort during exercise and immediately after exercise. And that doesn't necessarily mean that the joint is being damaged. At the same point, if they've exercised and 2 hours later their pain has not gone away or it's increased, you want to make sure that next time they come in, you want to decrease the duration and the intensity level that they're working at. You want to encourage them to exercise during the time of day when pain is typically least severe. You want them to also have good shoes. You want to have shoes that are shock absorbent and provide stability. And also incorporate functional exercise such as the sit to stand and step ups as tolerated to improve neuromotor control, balance, and maintenance of activities of daily living. And if they choose to do water exercise, you want the temperature of the water to be 83 to 88 degrees Fahrenheit because the warm water helps to relax muscles and reduce pain. All right, thank you for listening. I hope y'all have a great day.